The one and only Dr. M.J. Collier on with us this morning. Y'all give it up, show your love for the one and only Dr. M.J. Collier.
Yes, sir.
Good morning, Ricky Smiley. Good morning, all of Ricky Smiley Morning Show listeners, Brett and Eva and all the crew. Good morning, Ricky. And good morning, Gary with the T. Listen, it's time for our coronavirus update, and a lot of things happened over the weekend, Ricky. And now around the world, we're right at about 3 million worldwide cases. And in the United States, we're bumping at 1 million. So 1/3 of the cases in the world are now blessed to be in the United States of America. So we've had 55,500 deaths, and about 120,000 people have recovered. So the numbers are there. Why the United States is disproportionately being affected, we don't know. But one of the things that's surprising people, again, is that the cases are still basically going up. But we told you that was going to happen because the count is a little behind, the actual data here. So we're going to talk about signs and symptoms once again because I was on call this weekend for a group of doctors, and in addition to a lot of my regular patients, I had a lot of people calling me. I guess they were trying to decide to venture out or not, and so people were coming back saying, I feel this and I have these symptoms. So we're going to go over the recognized signs and symptoms of coronavirus or COVID-19. The number one symptom, of course, is a dry cough. Number two now, repeated shaking with chills or shaking chills. Number three, muscle pains or arthralgia. Number four, headache. Number five, sore throat. Number six, loss of sense of taste. Number seven, loss of sense of smell. Number eight, nausea and GI upset. Number 9, diarrhea. And number 10, the top 10, pink eye or conjunctivitis. So if you have any or all of those symptoms, coronavirus would be on your differential diagnosis. Neither of them means that you have it, but I'd like for you to have some of those symptoms. But people are just, they're afraid. They're still afraid. They're calling me saying, I just don't feel right, or I have this symptom or that symptom. What do you think? And so, I'm telling them what they need to do and what they need to be concerned about. But if you have any of those symptoms, Ricky, the main thing is when do you seek medical attention? If you have trouble breathing, you got persistent pain or pressure in your chest, if you're newly confused or have an inability to be aroused, and of course, if your oxygen is so low that you start to turn blue around your lips, your face, your fingertips, etc. So those are the things that we are concerned about.
Hey, Dr. Collier, I got 6 quick questions. I'm going to try to get them all in real quick. Now, Dr. Erickson out in California, Dr. Erickson out in California had a press conference over the weekend stating that COVID-19 potentially has the same death rate as the flu. What's your opinion on that? I got 6 more questions. Give them the real short answers.
Okay, very good. That is what the data is showing us, Ricky, that the death rate is about where we are with the flu right now. So we thought that it was going to be higher. We were preparing the hospitals and the medical, the entire medical culture was preparing for overwhelming infection that was going to kill more people than it has. It's killing people. Let's be clear about that. But it's not, greatly exceeding the death rate for the flu.
Right. And then he said that that sheltering in place potentially harms your immunity because you're not getting exposed like you usually would.
Well, that's absolutely correct. And we talked about that last week, and we'll reiterate it right now, that being, avoiding being exposed to the pathogen just delays your exposure. And once they open things up, it's going to be a lot of people that are going to get it because they have not been exposed to it. So it's going to be a big bump. Because people, when you're sheltering in place like this, you're not exposed to the virus or bacteria or any other infectious disease, then it hasn't gone anywhere. It's just kind of waiting. And so that will be the most vulnerable population, the individuals that have effectively sheltered in place, the ones that helped us blunt the curve. Once we open everything up, then they're going to be the ones that will, it's going to be a significant number of them that do get the virus.
Okay, I got about 3 more questions I'm going to ask you on the other side, Dr. M.J. Collier. Thank you for coming on with us this morning, man. This is really good stuff, and it's a lot of good information, and I really appreciate you coming on, coming on the show this morning. They're just killing some of these theories and answering some of these questions and stuff. So we got more Dr. M.J. Collier coming up next, 9 before the top of the hour, Rickey Smiley Morning Show. Dr. M.J. Collier, it's the top of the hour this morning. It's the top of the hour now. No, it is this morning. What the hell is I'm talking about? Dr. Collier, listen. Now, one thing that we all been hoping for is that people who have recovered from COVID can help cure those that are sick with plasma, but now the World Health Organization is saying that maybe not. That might not be the case because people are getting reinfected.
So the plasma, the recovered plasma therapy is an effective therapy. The World Health Organization is saying that it might not give you long-term immunity, but once the antibodies have that, you have to get a large enough antibody load that it's effective. And the amount of antibodies that people have after having the infection will vary from person to person. And so it depends on where that person is in their recovery period when you harvest those antibodies. But the antibodies are an effective way to do it, but it's labor intensive, it's cost intensive. And, so the benefit here is not necessarily outweighing all the things you have to do to capture that plasma and then utilize that plasma.
Right. Now, ABC reported that doctors say more deaths happen weeks earlier from COVID than previously thought. Some are speculating even as early as October, November. What do you think?
Absolutely. There were a lot of people that thought that they had, just the traditional flu. They tested negative, but they were still given a presumptive diagnosis of influenza A or B, or they thought it might be a mutated version of or a new type of flu. They didn't have the term or the name corona or COVID in their vocabulary at that time. So one thing about doctors, you can't make a diagnosis if that diagnosis is not in your lexicon. When they just say respiratory symptoms or a person died from pneumonia, they would just kind of give them a general diagnosis as far as death was concerned. But when they analyzed some of the tissues now genetically, they have found coronavirus, and it was here in the United States months earlier than they thought. So the first case was not out of a nursing home. It may not have been the cases in California that they have identified, but it was here in the U.S., and it did ultimately spread across the country, infecting all 50 states.
Right. All right, Dr. Collier, let everybody know how you can be reached.
Okay, you can reach me on all social media at Ask Dr. MJ. We'll answer your coronavirus questions and any healthcare question that you have. Next segment, Ricky, we're going to talk about two things, how antibody testing is going to change everything, and then is there a new cure coming out of Madagascar, the Madagascar COVID Organic. We'll talk about that and then give people the real truth about it.
All right, y'all, Dr. MJ Collier, hey, we really appreciate everything. Gary got the tea and the clue today. Coming up next, and I got your wake-up calls. Call me right now, 866-9-RICKEY. Call right now with your wake-up calls, man. Let's have some enthusiasm with these shout-outs this morning. Rickey Smiley Morning Show.